Welcome to the SIBO Doctor podcast with Dr Nirala Jacobi, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. Medical experts join us to discuss functional digestive disorders, clinical practice and research as it relates to SIBO and associated conditions. Head over to thesibodoctor.com where you can learn everything about SIBO from the basics to advanced treatments. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. We welcome you to head over to the SIBO Lifestyle Facebook group, where we post frequent tips and videos to help you on the road to gut health recovery. And now, over to Dr. Jacobi and the SIBO Doctor podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor podcast. And with me today, I'm very happy to have Dr. Ginger Nash talking to me today about the importance of lymphatics. Dr. Nash graduated from the National College of Naturopathic Medicine in 1998. Same year as me. Oh, that's good.
Yeah.
I'm from Bastir, though, and has also been 20 years in clinical practice doing excellent work in women's health, and uses a lot of natural hormone balance without the use of hormone replacement. She also uses complex homeopathy, herbal medicine, and nutrigenomics. And she has also been a professor at the University of Bridgeport College of Naturopathic Medicine Clinic for 6 years and has taught seminars for other healthcare professionals throughout the US and Canada, and is a very sought-after speaker, and has actually recently launched an online health program for women called Feminology, and you can find her on Facebook in her Feminology group that she co-founded, I think, with your colleague, Dr. Tara Nayak. Is that how you pronounce it?
Correct. Yes, Nayak. Yep.
So a real expert in women's health, but we're really talking today about the lymphatics. And one of the reasons I wanted Dr. Nash on the podcast is because she wrote an excellent article that I think you just got inundated afterwards, but it's called The Lymphatic System, a Critical Factor in Female Hormonal Balance. And it was written in Naturopathic Doctor News and Review, and we'll have the link in the show notes as well as the full bio. Ginger, we're on first name basis anyways.
Yeah,
we're friends.
Definitely.
So, tell us a bit more about the lymphatics. I think one of the reasons why I thought it would be so great to have you on the podcast is because it's not just female hormones, it's also the digestive tract, obviously, that's completely peppered with lymph nodes and obviously the gut-associated lymphatic tissue. There is such a plethora of important structures that involve the lymphatics. Can you just talk us through it a bit more?
Yeah, absolutely. So the lymphatic system serves as the entry point, right, for all of the dietary lipids, which are taken up by the enterocytes, which are the epithelial cells of the intestines, and that whole mesentery, the whole lymphatic support system that surrounds the small intestines, right? So this is critical to your work and critical to everyone who has a digestive system, which is hopefully all of us. And there is such a fantastically intricate relationship between the lymphatic system and the gut. So for me, the lymphatic system is always something I'm considering when I start treatment with a new patient and throughout my whole, working with somebody over many years. If the lymphatic system is not addressed, it's my belief, and I come from a background, as you said, in complex homeopathy and terrain medicine. If the lymphatic system is not addressed at every stage of treatment, we really run the risk of just translocating the toxins from one part of the body to the other. And as naturopathic physicians, of course, we always want to treat the gut, right? We always want to address the gut, especially at the beginning stages of working with somebody. And for you, who is an expert in digestive issues, and SIBO is probably the focus of much of your practice is working with the digestive system. So if the lymphatics are such an intricate part of this, and SIBO in particular, and the immune system, 80% of which is found in the gut, it's a no-brainer really that we have to address this system and make sure that we are eliminating, because that's what the whole lymphatic system is doing, is picking up all the toxins of normal cellular metabolism and dumping them and helping the body eliminate them. So if we're not eliminating properly, so the focus on eliminations is so key for me, we're going to, like I said, just run the risk of moving things around and potentially making the patient worse, driving these things deeper into the system and not helping, balance out from a superficial level, which over time we get deeper and deeper. So I became interested in the lymphatic system in particular because, first of all, there's not a lot of good, lab tests, blood work, et cetera. Nothing really reflects this very important system in our body. And of course, we know it's a separate circulatory system unto itself, separate from the heart and the blood vessels and blood, but it's critical. I mean, if our lymphatic system stopped flowing, we would die within a few hours, which is pretty amazing, right? So I started using whole body regulation thermography exams as part of an initial workup. And there's about 18 points that are measured with this whole body evaluation. And a lot of those points are points that reflect the health of the lymphatic tissue in different areas of the body. Of course, the tonsils and the throat. The tonsils are really just like big lymph nodes. And then the axilla and the breast health, and then the groin and the gut health. So I would see various ways that the body was able to manage the lymphatic flow. And there's sort of different levels of lymphatic activation, if you will. So sometimes I would see more of an acute process happening, more of an inflammatory. And with people with SIBO, you might see more of that, like acute or subacute situation where their body is still trying to compensate for some of the potential, dysbiosis and potentially infectious aspect of gut health. And then there's like older, more chronic, more rigid signals that you would see. So I immediately could see that there was so much happening with the lymphatics in the body and that it was connected to all these other parts of the system. And that's what really made me so fascinated with the lymph. And, as you mentioned, I wrote an article about the connections between lymphatic health and hormones. Well, there needs to be a lot more research with that. But of course, we know the lymphatic system plays a huge role in digestion and gut health. So it's been a pretty huge part of my interest for the last 7 or 8 years.
Yeah, and you use a lot of different types of medicines that are pleomorphic, I guess, or would you call them pleomorphic? These are
complex homeopathy. I'm not a classical homeopath. I don't use just one remedy at a time, although I will use single remedies at times. But really, I'm more interested in a organ system approach and a terrain approach. So thinking about potentially miasmatic influences, but also using medicines that are more complex, and the herbal compounds that I use are based on formulations that come more out of anthroposophical medicine and Chinese medicine, and addressing different levels of what's happening in the body instead of just trying to give a Band-Aid for each different complaint, so.
And for those of you listening that are sort of unfamiliar with those types of medicine, we always get a wide range of practitioners as well as patients listening into these podcasts. These are medicines there's few ranges. I think in your article you mentioned Reckeweg, and we have the Reckeweg medicines here in Australia. In America, before I left America, I used a lot of Picana and Unda numbers, and these medicines work on what are called the emunctories, or the terrains or the terrain of the system, and they work on drainage or normalising and detoxifying these routes of detoxification of the body. So it's sometimes really profound. Actually, it's often very profound, especially in patients that are very sensitive, that can't handle a lot of medicines. These are the patients that I see. Even just yesterday, I saw somebody that's severely underweight and can't manage, not just foods. They have a lot of food sensitivities, food intolerances, but also to medicines. And so sometimes I start, and sadly, we don't have all of those available here in Australia. We're pretty limited. But for those of you listening that are in a bind, that have tried a lot of things, try to get a naturopathic doctor, and then see if you can get somebody that does what Dr. Nash does, which is using some of these other types of medicine and is very well versed in it. That's the other thing. You can't just pick them off a shelf. You really need to understand the system with which they are applied and prescribed. Now,
absolutely.
So do you... can you give us some idea as to what, besides thermography, which is a great way to assess probably more than just lymphatics, but and I don't use that technology, but are there just simple symptoms that patients can look out for, or what would the practitioner look out for to kind of think about the lymphatics? Because we're so in protocol with this is what you do for SIBO and this is what you do for detox, but how do you really get to the lymphatics and what are the symptoms?
Absolutely. Great question. So, of course, the most straightforward and simple thing is if people have chronically swollen lymph nodes, right? If somebody has lymphadenopathy, and you'll be amazed, sometimes you'll palpate people, and if you get really good with your palpatory skills, you'll find a lot of lymphatic swelling, down the cervical chain, submandibular, people that get a lot of sore throats, of course, and tonsil problems. That's all issues with the lymphatics. Certainly the same is true in the groin or in the axilla.
That's the armpit, folks.
Yeah, the armpit. So especially women that are concerned about the health of their breasts or have, concerns about developing breast cancers or inflammatory breast issues, or even just have a lot of swelling premenstrually, or breast tenderness, or tenderness in the groin area. All of these things can potentially reflect problems with lymphatic health. And then, of course, edemas, right? Because it's the lymphatic system that's picking up the fluid that's flowing through the connective tissue that we refer to as the interstitium and the fascia and all of that connective tissue that's now being talked about as like a new organ that's been discovered, whereas one of these things, of course, like naturopathic doctors have been talking about this for a long time, but it's a new organ, and it is absolutely essential, as you mentioned, for us to help the body eliminate first before we do more pointed detoxification protocols and medicines. And this is something I work with all the time because I, like you, Nirala, have seen so many really sensitive patients. Like I have a patient who's severely underweight. I just talked to her today. She's also got an incredible case of ITP, low platelets. And she's starting out on the very most basic drainage remedies to help stabilize her system, help stabilize the immune reactions. And this is another essential role of the lymphatics, which I haven't mentioned specifically. Of course, the lymphatic system moves all of our immunoglobulins around, our white blood cells. The spleen is an organ of the lymph system. So if anybody has splenomegaly, then they have a lymphatic problem as well. So there are certain types of things, chronic sore throats, chronic swollen glands, chronic edemas, any of that type of thing. Of course, anybody who's been treated for various cancers and had lymph nodes removed, you can assume that they need extra lymphatic support as well, even if they haven't developed, hopefully, lymphodemas, full-blown lymphodemas. So it's really tied into the immune system as well. And as I was preparing for talking to you tonight, I was thinking about, how these various bugs that get, into the small intestine where they shouldn't be, they are going to put an extra burden on this whole lymphatic system of the gut. I mean, there's a condition, right? Mesenteric lymphadenitis, where bacteria have been translocated to the lymph nodes in the gut. And then you get this like diffuse inflammatory stress on the immune system. I'm sure, right? This has got to be related to developing autoimmune issues. And, certainly if somebody has leaky gut, then you're going to be up, ramping up those sensitivities and the mast cell and that whole thing too. So it's all very important for the lymphatic system to be working optimally so that we can eliminate all these toxins and that our immune system can be robust and help us get over things like SIBO,
I think you made a really good point there. And one of the most common issues I see with people with chronic digestive disorders, they also have a really dysregulated enteric nervous system. And I thought about that. I thought about, all right, well, we know that the vascular system relies on also the nervous system for innervation, etc. But I'm not so sure I know about the connection between the enteric nervous system and the lymphatics, because lymph moves very differently, doesn't it? But is there also would you suspect that if somebody is in a chronic state of fight or flight, like a lot of my patients, would that affect the lymphatic system as well?
Absolutely. Absolutely. Because and it's which came first, the chicken or the egg? Like, do you have a sphincter issue where you're developing SIBO, or do you have low bile acids where you're developing SIBO, and then the immune system is extra taxed? So then it puts these chronic inflammatory compounds in the system, and then that eventually the nervous system gets hypersensitized because of this? Or do you have chronic stress or an infection? Like, I treat a tremendous amount of Lyme and co-infections. I mean, we all do, but I'm in Connecticut, so it's ground zero of Lyme around here. So that is something I see all the time, is people with infectious diseases, which many of us have, as a root cause of our problems, that will severely impact both the lymphatic system and the nervous system and the immune system. There's been an incredible correlation with people that have been hospitalized for a severe infectious episode. They are something like 60% more likely to develop an autoimmune condition and a mood disorder. So we know that these things are intimately related. We know that so many people with depression, anxiety, and nervous system issues, there are fundamental biochemical underlying causes that contribute to this, and so again, it's like this lymphatic penetration throughout the circuitry of the whole body, the whole extracellular matrix. This is where our nerve conduction happens. So if we've got, I'm a craniosacral practitioner, and I see this all the time. Even if we've got a torqued or a scarred part of the body where the connective tissue is not flowing freely, or it's not allowing for the lymphatics to flow freely, you see these, when you unwind the connective tissue, you see the nerve synapses fire. You see like a release, a tissue release. And this could absolutely be related to gut cramping, chronic nausea. I talked to another new patient today, a woman with pretty severe hormonal issues, a young woman. But one of the things that happens for her is she gets this terrible chronic nausea. And of course, that's related to hyperstimulation, the enteric nervous system, and the gut. So Wouldn't it be great if it was all just one thing? It would make our job so much easier, but these things are
But it would be
all
so boring, wouldn't
interconnected,
it?
right? They're all interrelated. Yeah,
Yeah.
it would be so boring. And then we
Yeah.
would just take out our prescription pad and say, oh, you have X. We just give you this drug to suppress the nervous system, and then you won't have this symptom anymore. So of course,
Yeah, exactly.
We're joking, but
yeah. So, I'm just thinking out loud in terms of, I'm thinking about some patients, and I know that, I think one of the reasons why SIBO is such a really a hub for me in terms of interest in the digestive tract is that it can cause so many different things. And and it can be so difficult to treat for some people, especially those extra sensitive ones. So I'm still thinking about detoxification, and a lot of people just have a massive reaction to detoxification. Do you see that as a potential issue with an overloaded lymphatic system? Let's say, is that one of the things to consider? Is like if you have a patient,
because you're just pulling these toxins out of the cells, and then where do they go? And if you've got somebody with SIBO with constipation, right? If you've got a diminishment of the peristalsis, that is essential to keep the lymphatics in the gut, especially moving, because the lymph, I haven't mentioned this yet, doesn't have a central pump, right? Like the heart that moves the blood all around the circulatory system. The lymphatic system requires the proper muscle contractile. So if you've got chronic constipation and peristaltic action, you can automatically assume that the GI associated lymphatic tissue is really compromised. And so this is why you have to get people moving the lymph in their gut, and dry skin brushing and sauna and everything, and inversions and rebounding and exercise.
Okay,
and all those
slow down. We're going to talk about all of those because I think those are all excellent.
All those things are essential.
I think you just hit the nail on the head. It's like, there are so many people, especially with constipation, that really fit that criteria of very reactive and blah, 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 all the things we've already mentioned. So for those of you listening, if you're constipated, it's pretty as much assumed that you have an issue with your lymphatics. So let's talk about what we can do about it, and what are some of the home treatments people can do for themselves, and what can we do as practitioners to support them.
So if you are constipated, yes, Nirala, you can assume that your lymphatics are stressed, are struggling, are sluggish, etc., because that peristaltic action is necessary for keeping the lymphatic flow from the gut throughout the rest of the body, and it starts in the gut. So we have to think about creative ways to help patients without doing these intense detox protocols, because those are going to make the patients worse. Absolutely. So I would never dream of doing detox with somebody until their emunctories were supported, until their body was eliminating effectively. And some very simple things that you can do is do dry skin brushing on a daily basis. You start on the gut. There's plenty of good YouTube videos, people that have made excellent little simple, it takes 90 seconds, and you start on the gut and you just do very superficial light strokes. Everything is in, lymphatics would naturally flow. And do some massage. There are certain yoga postures that of course stimulate the digestive practices for people that have a lot of gas and bloating, which so many people with SIBO do. There's, wind releasing pose and all sorts of
I think that's down dog, isn't it?
Put that compression. Yeah, well, no, that's actually an inversion. So that will help the lymph too. But wind releasing pose is your leg is bent and it's and it's up towards your chest.
Oh, yeah.
So that will help get the gas moving out. And of course, simple things like staying hydrated is super important as well, because the lymphatic system needs proper hydration levels. But, movement and exercise is critical to a healthy lymphatic system. And when you exercise, even walking can increase the lymphatic flow by maybe threefold. When you do more vigorous exercise, light jogging or running or rebounding, so jumping on a mini trampoline, that can increase the lymphatic flow by 5-fold.
Oh, great.
So you can,
And
yeah.
how long do you recommend? Because I often tell people to get a mini rebounder.
Yeah,
And
5 minutes a day is what some of the research has shown a reduction in breast cancer risk by like 20%, 5 minutes a day on a rebounder.
What?
Yeah.
Wow.
Yeah.
Just because of the
sure
lymphatics. Wow.
Yeah, it must be, right? I mean, because it's just moving the lymphatics, it's helping you eliminate, it's helping with the gut. And of course, you have to have the right bacteria in there in order to eliminate those excess estrogens. But the movement of the lymphatic system is super critical in terms of breast health. So there are some very simple things like that. I also love to do infrared sauna, and I often have people do the dry skin brushing before they get into the sauna, so that you are stimulating the heat shock proteins and the heat, of course, that's penetrating into the fatty tissue layer, which is, the lymphatics are pretty superficial. So you're going to get all kinds of benefits for eliminations from the infrared sauna. But again, it's more of a gentle, natural process, if you will, than a detoxification where you're really pushing the liver to, metabolize things more aggressively, or you're doing like a big colon cleanse where you're putting a lot of certain types of irritant laxatives in the bowel or something like that. I would never do that with my sensitive patients.
Yeah, no.
Before making sure that the intestinal tract, the lungs, and the kidney are all really optimal. Those are the three main emunctories. And then, of course, the skin is another huge, and there's skin-associated lymphatic tissue as well, lymphoid tissue. And when the lymphatic system gets clogged, you can see some people with acne and with chronic skin conditions, folliculitis, that can sometimes be a reflection of a lymphatic issue as well. So like you said about SIBO, it's like a hydra-headed issue, and certainly the lymph is involved, in my opinion, in almost every one of these phenomenon.
Yeah, so. I think that's it's so good to hear these old treatments making maybe not a comeback because they never left in our book, but to hear people talk about sauna. I'll also have somebody on for hydrotherapy coming up soon. And for those of you who have not heard about emunctories, go back through the SIBO Doctor archives, the podcast archive. I have a podcast with Dr. Chris Shade where we sort of nerded out about the emunctories and detoxification. But we really didn't talk about the lymphatics, so I'm so glad that we get a chance to do that here. Let's go back to the sauna, though, because I think, because I tell people, look, if you like saunas, invest in actually installing a sauna in your house. Now, I'm old school, and I'm from Germany, so I like the...
Yeah, I was going to say, your accent betrays some old school sauna action there.
Very, very old school. In Germany, I grew up in Germany, and sauna we didn't have a sauna in our house, but it was a part of the culture. And when I recently went, I went to one of the thermal baths, and they have like 5 different saunas, right? They have like... a Swedish, and then where you have like little birch switches that in between the session, you have to beat yourself with the birch switches. You jump in then a glacial lake in between, and then you drink a liter of beer, and like it's like a whole system. And then the other sauna I went to, you walked out of the sauna, and there was like literally a huge beer barrel full of ice cubes. And it was like a 10-step process of what you're supposed to do. You're supposed to rub yourself down with ice, and you're supposed to walk, then you're supposed to lie down and put your feet up, and then you're supposed to rinse with cool water. And like, it was just a whole process. And people don't appreciate the beauty and the science behind that as to not the beer drinking maybe, but... But perhaps, like the fact that are
for
really
Germans, that's probably beneficial, you know?
And we thought it was the best day of our lives, my husband and I.
Yeah.
But
I spent a day in Moscow in the Russian baths too, and got beat with juniper bushes. The old Russian ladies beat me. That was amazing.
Oh my God.
Too.
Yeah. So if you haven't lived, if you have
American culture, almost every culture has a sweating, as part of their
Yeah, and that's a really good point, because
benefits.
and I tell my practitioners, I say, look, I always have that on my questionnaire is, can you actually sweat? Ask your patient that, because if your patient says no, I have a hard time sweating, that gives you a clue that you have to retrain that whole system. So getting back into the sauna for a second. So far infrared, how long do you recommend people stay in there? Or is it just to tolerance until they sweat?
Well, good question. So one of the things you mentioned about, if you're serious about a sauna, get one installed in your house. I would love to have a beautiful cedar, wood sauna here, or some type of natural. But for me, I actually like the portable ones where your head sticks out like a little tea cozy, because I was a former migraine sufferer. So I find that for some people, the very sensitive people, getting the head heated can be difficult for them. Sometimes it can actually cause some, aggravations that you don't necessarily want. One way of potentially getting around that, and I have done this many times when I've gone into a full body sauna, is to have something cold, an ice pack or a cold cloth that you can put on your head, so that you're not just driving all the blood and the circulation to the head, which can sometimes lead to an aggravation. But as far as length, it's, again, so individualized. Like for my chronic Lyme patients and really severely sick patients, they can only tolerate maybe 5 minutes without getting a terrible aggravation. So, if you're healthy and you're robust and your emunctories are open and you're not constipated and you're hydrated and, you sleep well and you've got, relatively little stress and you feel generally very healthy, sure, 30 minutes at, a pretty high temp where you're really sweating, really, really sweating for a long time, you could probably handle that. I always recommend for people that have blood pressure issues, you have to be careful with this too, either low or high blood pressure. And also you want to, replace electrolytes afterward as well. And another really key important thing, in my opinion, and I've had some back and forth with certain people about this, is that you don't want to do this process every day, because what it's doing is it's stressing your system. So when you heat your cells up, you upregulate all these heat shock proteins, these like little Pac-Men inside the cells that are going to eat up misfolded proteins and junk that's left over inside the cytoplasm cell. So you want to give your body at least 24 hours, if not longer, to complete that healing process, because it's the shock of the heat that's causing the, hormesis and the homeostatic mechanisms of the body to turn on. So you want to give your body the chance to, you don't do a sweat lodge every day. You don't go to the baths every day. You give your body a chance to recover and eliminate. And then if you're doing light exercise or dry skin brushing or working on your lymphatic system on a daily basis, then the lymph can really take its time in eliminating some of those toxins that you're freeing up from the source of the heat, whether it's a bath or a sauna.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.